Hi everyone, welcome to ResearchMD.com. We got another great presentation. Today we're going to look at bilirubin metabolism. Again, my name is Pramil, Cheriyath. I'm a physician, I'm a program director, internal medicine residency and transitional residency in the United States, and I'm an assistant professor of medicine to large medical school also. So let's get into our topic. When we think about bilirubin, what does people usually think about bilirubin?
It's a waste product.
Louder.
It's a waste product.
Waste product, but that's not true, okay? What I want you to do today, if you go to PubMed, put Pramil Cheriyath, then I did a paper on bilirubin and diabetes, okay? The bilirubin is also an antioxidant. So, if you look at all the world bilirubin, put it on a graph, and you look at the people who have upper limit of bilirubin, that means, let's say, what is a normal bilirubin? From 0.7 to 2.0, that's considered normal. Let's say your bilirubin falls between the upper limit, maybe from 1.5 to 2, okay? Don't get scared. That's almost like a protective thing for you because you got a lot of antioxidant properties. So please read my paper on bilirubin level and the diabetes as a protective factor. The reason I said that, we have to take that waste product out of the system. Think also an antioxidant. But today my goal is to make sure we know everything about bilirubin metabolism. Okay, let's start up here. That's our topic, bilirubin metabolism. Let's go and visit RBC. What happened? RBC lysis, and the hemoglobin is broken down to heme and globin. Okay, the globin get recirculated. We're not worried about it. Everybody got that? So what happened to the heme? The heme has like two parts. One is the free iron, and the other is like a 4 pyrrole nuclei, like a chain. See the chain right here? Okay. So, what happened to the free iron? They joined with the transferrin and the iron storage and all that. We're not too much worried about it. Okay? So, we're going to follow this. So, what happened to this 4-chain pyrrole nuclei is heme oxygenase convert that into bilirubin, an important product. Okay? And this bilirubin is bilirubin reductase act on it to make unconjugated bilirubin. Okay, so we need to know this an important name, unconjugated bilirubin, which is what? What does that say? Somebody said lipid soluble. Remember that, it's always lipid soluble. Okay, so now everybody know like how we got unconjugated bilirubin, right? Very, very important. Now, what happened to the unconjugated bilirubin? That enters the liver. Okay, when it enters the liver, another important enzyme, what is it called? A glucuronil transferase. Okay, say that again.
Uridine glucuronil transferase.
Uridine glucuronil transferase. So that is the one kind of conjugate, make the unconjugated become a conjugated bilirubin. Okay, so what happened to this conjugated bilirubin? Is that lipid soluble or water soluble?
Water soluble.
Water soluble. Remember, unconjugated lipid soluble, and the conjugated become water soluble. Okay, so this process happens in the reticuloendothelial cells of the hepatocytes. Okay, that's what, this is the system. That's why I drew this picture right here. Okay, so the enzyme is sitting in the smooth endoplasmic reticulum. Anytime that kind of gets stimulated, what happens? Increase UDP glucuronil transferase. So I say glucuronil transferase. Okay, so it's very important to know when the smooth endoplasmic reticulum gets stimulated, you can have like a, UDP can go up. Okay, the reason I said that, some of this drug, phenobarbital, anticonvulsant, antihistamine, that can stimulate the smooth endoplasmic reticulum of the hepatocytes. And what happened to our glucuronil transferase? Okay, that goes really high. We'll come back to that. Just remember what happening in the endoplasmic reticulum, smooth endoplasmic reticulum is very important. How does it get stimulated and all that? Okay, so what happened? The unconjugated become conjugated, then kind of secreted in the biliary canaliculi. So if we come back up here, once the conjugated bilirubin, right? What is the next step? What are they going into?
Large intestine.
Huh?
Large intestine.
Large intestine. So what happened? The large intestine. What is sitting in the large intestine?
Bacteria.
Colonic bacteria. They do. That's why we always said to this. We always think bacteria is bad and all that, right? So when you give like antibiotic therapy, bacteria get killed. That's where a lot of problems kind of happen. So this, everything in the body has a function. The colonic bacteria convert that into stercobilinogen. Everybody got that, right? When stercobilinogen is converted into what? Stercobilin. How does that happen? You got air in the stool, right? And then oxidation happens. Okay? Once the oxidation happens, you get the stercobilin. That's your next step right there. Once the stercobilin comes in, that's come through the stool, that give the color of the stool. Okay, so somebody tell me what happened in obstructive jaundice? What happened to the color of the stool?
It becomes pale
Why is that?
because the bilirubin is not coming.
Yeah, there's not much stercobilin. That's what give the color in. So if there is a block, you will not get a stool is going to be like pale.
Pale.
Okay. So what happens? Some of this, like 20% of this, get reabsorbed back into the in the enterohepatic system. And then what happens is some of them 5% over here go to the kidney also. Right? Everything is gonna go different places. When you go to the kidney, what happened? Urobilinogen is formed. Right? You got the urobilinogen up here, 5% kind of come up here. This is urobilinogen. What else is in the urine? There's some air in there, right? So that become oxidization, and then urobilin, which give the yellow color to the urine.
Yeah.
Okay? So what happens if there is an obstruction? Sometimes you have this bilirubin and all that kind of leak into the blood, and you can still have more urobilinogen going into the kidney, and then you can have more urobilin is produced, so the urine becomes what color? Dark.
Dark.
Right? Everybody got that. So we need to understand two things. People get confused. So what happened in the store when there is an obstruction? There's nothing. This one is decreased, right? Stercobilin is decreased, color become pale color, no color for the stool. But when you come to the urine, because some of them is kind of leak into the blood, bilirubin, you still have urobilinogen, more urobilinogen, there's more urobilin, right? And then what happened to the color in the urine? It goes up. Everybody got that? Okay, that's in a nutshell like what's going on and all those kind of things. So let's summarize a little bit more. You got the RBC broken down, then hemoglobin broken down to, what are the two products? Somebody tell me.
Hemoglobin.
Hemoglobin. Are we worried about globin? No. So look at the heme. What happened? There are two parts. Somebody tell me the two parts.
The free iron and the
Free iron, which is combined with the transferrin and go out. We're not worried too much about it. What is the other thing?
the 4 pyrrole nuclei.
That the chain. Okay, 4 pyrrole nuclei chain is there, and heme oxidase is working on it to convert it into biliverdin, and the biliverdin is kind of converted into unconjugated bilirubin by biliverdin reductase, which is lipid soluble. Okay, and then combined with the albumin, unconjugated bilirubin enters the liver cell. Right? On the liver cells, all this smooth endoplasmic reticulum. What is the most important enzyme there? Somebody tell me. Glucuronidase transferase, right? So the glucuronidase transferase in the smooth endoplasmic reticulum, when it gets stimulated, more glucuronidase transferase is going to produce. It becomes conjugated bilirubin, which is water soluble. Boom! It comes to stercobilinogen and the stool. Some of them get rid of it. Some of them go back to the urobilinogen, the enterohepatic circulation. 5% go to the kidney and oxidation, urobilin, and all those kind of things. Okay, this is the normal thing. What happened in abnormal situation? So look at this side. What happens over here? Okay, let's look at some of the conditions, or the abnormal conditions, right? What are the normal things we usually see, like what? Hemolysis. What happened in the hemolysis? Increased bilirubin. What type of bilirubin?
Unconjugated.
Unconjugated. Always remember that, right? This is the part happen. Unconjugated goes up. Okay, excess release, hemolytic anemia, right? So that's like increased bilirubin. Now let's look at the defective conjugation. What are the two things? Crigler-Najjar syndrome, right? And then there's the Gilbert syndrome. Those are the two things. Which one is more common? Gilbert. Okay. When you have like a lab report, when you said like the total bilirubin is a little bit, maybe 2.1, 2.2, 2.3, things always kind of, what is the most common? Like Gilbert. I think like 5 to 10% of the people can have Gilbert syndrome. And they usually appear like more pale, and I think maybe that's like antioxidant. because of the antioxidant, they look very younger too. Anytime if you look at the people with the Gilbert syndrome, they look, younger, nice color. So that's probably a good thing for them. Okay. So what happened is that defective in the conjugation. Remember that. So what are the two things? You got Crigler-Najjar syndrome and you got Gilbert syndrome, which is the familiar and non-hemolytic jaundice. Both of them is unconjugated or conjugated?
Unconjugated.
Unconjugated, okay? So both of this thing is, now let's look at the conjugated part. You got defective excretion into the bile, right? Over here, where does it happen in this part?
Bile canaliculi.
In the bile canaliculi. There is defective excretion into the bile. So what happened? Increased conjugated bilirubin, okay? And that is called Rotor syndrome. Then you got Dubin-Johnson syndrome, right? So Dubin-Johnson syndrome is you got increased conjugated bilirubin. Remember that. This is the conjugated, increased conjugated bilirubin. Okay. Now, when we talk about all this, good to know like some of the drugs and how does it affect. If you take phenobarbital, anticonvulsant, and antihistamine, okay, phenobarbital as a role, not only, what do we use phenobarbital usually? Seizure medication, right? But it also has another role based on this. What does it do? It stimulates the smooth endoplasmic reticulum, okay, and induces, increase the synthesis of glucuronil transferase. Okay, so what happened to increase glucuronil transferase? You get rid of the bilirubin kind of faster. So this thing, Crigler-Najjar syndrome, mainly in the kids, to decrease the hemoglobin, there's a role for it. Remember that. And then remember, antihistamine and the barbiturate also plays role. They can stimulate the smooth endoplasmic reticulum. Anything which can stimulate the smooth endoplasmic reticulum in the liver cells can cause glucuronil transferase to go up. Okay, so remember that. So thank you so much for watching. If you have any questions, please put it under comments. Please subscribe to our channel. It will be extremely helpful. Thank you.